Television.
Presented by the National Science Foundation of Sri Lanka.
Hi, and welcome to me, Madala. On previous shows, we've taken a look at many different types of both man-made and natural disasters. But on today's show, we examine how best we can help other people and ourselves in situations of emergency.
නිල් පැහැයෙන් හැඩවූ එකමලොවක් නැත්තේ ගහකොළ මල් සුසැදී පනනල රැඳි සුරැකී ජීවිතයේ පිපිරෙන්නයි ගිනි කඳු ඇත්තේ ගලායන්ට දිය මං ඇත්තේ මද සුළඟද රළු විය හැක්කේ කඩා වැටේ උල්කා අහසේ
සුබාදාමෙමේ සියලු රහස් ගැන
දැනුවත් විය යුත්තේ විද්‍යාවෙන් තේරුම්ගෙන ලෝකය ජීවත් විය යුත්තේ මේ මඩ
Today's show is all about first aid, what it is, how it should be administered, and what would be appropriate in different situations. We start off though by taking a look at some situations that would certainly require that first aid be administered.
Throughout our lives, we are faced with all kinds of situations. Life is full of moments of happiness and joy. These are all part and parcel of our lives. The lives we lead is full of unexpected events, and sometimes these events can lead to different emergency situations. These unexpected events are called emergency situations. These situations can be divided into two categories: heart attacks, fainting, other medical emergencies, and accidents that occur on the road, home, workplace, or playground.
First aid. Goals of first aid. Situation management. What to do in an emergency situation. Giving first aid.
We're all quite familiar with the term first aid, but do we really know what it involves? Well, let's find out.
Until professional medical help arrives to a patient in need of urgent medical treatment, the assistance given to keep the patient alive or comfortable is called first aid.
There are three main points in first aid.
To save the life of the patient, to keep the condition of the patient from aggravating, to quicken the healing process.
The first thing to achieve in giving first aid is to help save the patient's life. If someone's life is in danger, the first thing to do is save the person's life. Secondly, not all medical situations are life-threatening. However, we must make sure that the person receives the proper medical attention before proper medical help arrives, and to prevent the situation from getting worse. Finally, if the situation is minor, such as fainting, all must be done to keep the patient comfortable until he or she regains consciousness, and to keep the patient comfortable until the condition goes away.
In life, it is always important to think before you act, and this is especially true in situations of emergency. If we panic, we're very likely going to do the wrong thing and just make things very much worse. So let's find out now about a very critical aspect of first aid called situation management.
When an emergency occurs, we tend to panic, lose control of the situation, act in haste, and sometimes move the patient in an effort to give them first aid. By doing so, things may worsen for the patient. To prevent such a situation, we must seek the assistance and advice of those who are trained and knowledgeable in first aid. So acting logically and with a clear sense of purpose in seeking initial assistance is known as situation management.
Accidents can happen anywhere, at any time, to anyone. But with the number of fatal road accidents in Sri Lanka, it does make one wonder how we compare to the rest of the world.
Annually, Sri Lanka suffers more accidents than any other nation of the developing world. This can be attributed mainly to our large population and congestion on the roads. Of all the fatalities in Sri Lanka, road accidents are the number one killer.
Every year, the number of people being hospitalized due to accidents increases. At the same time, the fatalities are also increasing due to accidents. Due to the ever-increasing number of vehicles, modern machinery, industry, environmental pollution, and various other reasons, the chances of accidents are increasing daily. So, it is important that accidents caused by these factors are reduced or controlled. If first aid is given to the victims of these accidents at the earliest instances, it may save many lives. Especially after the tsunami, the need for proper first aid training has been a key priority.
Let's now take a look at some very basic first aid steps we can take in the unfortunate event of an accident.
Steps to be taken in an emergency situation.
Assess the situation. Secure the patient and the surroundings. Seek emergency assistance. Get assistance. Assessing the situation is important. The first thing someone with first aid training will do is to ensure that the surrounding area is made safe and secure. If there are dangerous items around the area, they must be removed carefully, without causing injury to more people. Depending on the situation, it may be necessary to remove the patient or patients from the area carefully. The next step is to establish if the patient is breathing, if the air passage of the patient is opened, and if the patient is conscious. If the patient is not breathing or the heart has stopped, CPR must be administered. It is important that this is done by a trained person. Care must be taken not to cause any more harm, and all efforts must be made to get the patient under expert medical care as soon as possible.
Before taking an accident victim to hospital, it is important to assess the injuries and condition of the victim. All care must be taken when the accident victim is transported to the hospital, as the transportation process can cause more harm than good.
What can be done in a case of broken bones?
Firstly, reassure the patient and then make all arrangements to keep the affected area and the patient as still as possible. A splint must be used in order to prevent movement of the broken limb. Since we don't usually have such items in our homes, a rolled up newspaper or file cover can be a good substitute. After which, the affected area should be wrapped in a thick bandage, and the patient should be taken to hospital as soon as possible. All care must be taken to ensure that the patient is kept comfortable during the journey.
What you should do in case you cut yourself.
In such a situation, instruct the patient to apply pressure to the affected area. If it is an arm, raise it up. Seat the patient on a chair or on the ground. Next, take a clean piece of cloth and tie the wound firmly without applying too much pressure. Then, make every effort to take the patient to a doctor or to the hospital as soon as possible. Washing a wound with soap and water could aggravate the bleeding. Therefore, it is important to refrain from doing this.
Steps to be taken in the case of burns.
In the case of burns, the best action to be taken is to hold the affected areas under running cold water for at least 10 minutes. This can be achieved either by holding it under a tap of cold water or pouring water from a jug. Since water can be heated by body temperature, it is important not to immerse the affected area in a container of cold water. Always remember to hold the affected area under running water. Finally, keep a clean piece of plastic sheeting or clean wet cotton cloth on the affected area and immediately take the patient to hospital. Never apply toothpaste, aloe vera, herbal oil, egg white or salt on burnt skin.
Action to be taken in case someone is drowning.
Normally, we try to gently shake a person who has lost consciousness due to drowning. This is not exactly an effective way. We should try to talk to the person. We can try inflicting small amounts of pain or a small tap on the collarbone. Also, it must be established if the person is breathing at the earliest possible. To check the breathing of the victim, keep 2 fingers under the chin of the victim and gently lift the face up. Then keep an ear on the nose or mouth area and see if the person is breathing. Once it is established that the person is breathing, it must be kept in mind that he may have swallowed some quantity of water.
ඒක සාමාන්‍යයෙන් ස්වභාවිකවම එළියට යන්න පුළුවන්. ඒ එළියට යන්න පහසු වෙන්න මෙයාගේ හුස්ම ගන්න එකටත් පහසු වෙන්න අපි මෙයාව නිවැරදි ඉරියව්වකින් තියන්න ඕනේ.
We can position the victim in such a way that the water will come out naturally and normal breathing to begin. Once you keep the patient's face on the palm as shown, it will be easier for the water to flow out. There is no need for the water to be taken out manually as this is not the correct way to administer first aid to a drowning victim.
What to do if the victim's air passage is blocked?
අපි රෝගියාව මේ විදිහට අපේ අතට රඳව ගන්න ඕන. අපේ ශරීරයට යාව රඳව
We hold the patient like this and ask the patient to cough hard. We hold him like this to prevent the patient from being thrown forward and hurting himself.
කහින වෙලාවට ඒ කියන්නේ රෝගියාගේ කහි කැස්ස ප්‍රමාණවත් වෙන්නේ නැත්තම් ඒකෙන් අපිට
If the coughing fails to remedy the situation, we should slap the back of the patient hard 5 times. You bend him forward and slap his back 5 times hard using the palms of your hands.
මේ විදිහට ඉදිරියට ලිස්සලා යන විදිහට අපි පිට අත්පහර පහක් ලබා දෙන්න ඕනේ අපේ අත්ල උපයෝගී කරගෙන. එහෙමත් එළියට ඇවිත් නැත්නම් ඊළඟට අපි කරන්නේ මේ විදිහට
If this still fails to dislodge whatever is blocking the air passage, we hold him like this with one hand over his abdomen and the other hand held in this manner and apply pressure 5 times. Once in 5 times when you apply pressure, you must check to see if the blockage has been cleared.
අවස්ථාවකට පස්සෙම පරීක්ෂා කරලා බලන්න ඕනේ ශ්වසන මාර්ගයේ අවහිර වෙලා තිබ්බ ද්‍රව්‍ය ඇවිත් තියනවාද කියලා.
Finally, take the patient to a doctor. It is also very important to inform the medical personnel About the number of occasions the abdomen was pressurized, because the process can cause damage to one's internal organs.
What actions should be taken if bitten by a venomous snake?
If the victim gets excited, circulation will increase and the poison will spread throughout the body faster. Therefore, the first action is to keep the patient calm. Then, wash the bitten area well with soap and water. It is advisable to keep the bitten area below the level of the heart, as this will delay the poison from traveling to the heart. Under no circumstance should you tie a tourniquet around the bitten area, or make the patient move around. The patient must be either physically carried or taken in a chair to hospital. If the snake is identified, it is important that this information be given to the medical personnel. Or failing that, at least the carcass of the snake should be taken to the hospital, disregarding the effect to the environment.
Action to be taken in case of accidental ingestion of pesticides.
Most important in this situation is to check the breathing and the state of consciousness of the patient. Thereafter, steps must be taken to keep the air passage clear. And if the patient is vomiting, the head must be kept in this way, to clear the mouth and ease breathing. Finally, the patient must be taken to hospital as soon as possible. When doing so, it is important to take the bottle of pesticide that was ingested to show the doctors. When touching bottles of pesticide, it is important to use gloves. In case gloves can't be found, a polythene bag can be used. The patient along with the bottle of pesticide must be taken to the hospital. In case the bottle cannot be found, samples of the victim's vomit must be taken to determine the type of poison ingested. Do not induce vomiting under any circumstance. Refrain from giving coconut milk or soap water.
How to administer mouth-to-mouth resuscitation to the victim?
First, check the mouth for foreign objects. Spittle, mucus, or any other substance must be removed in order to clear the air passage. If there is something that cannot be dislodged even after using one's fingers, move the head back and check if the victim is breathing normally. There are 3 methods to check if the victim is still breathing.
ශ්වසනය චෙක් කරන ක්‍රම තියෙනවා 3ක්. අපි කියනවා look, listen, feel කියලා.
There are 3 methods to check the breathing. We call them the look, listen and feel method. We can listen to the breathing or feel the breath on our cheeks or earlobes, or we visually verify that the chest is heaving with the breathing. If after establishing by all 3 methods that the victim is not breathing, steps must be taken to give the victim mouth-to-mouth resuscitation. First, we seal the victim's nose like this and keep our mouth over the victim's mouth, sealing it as well, and breathe into the mouth. Do this for 2 seconds and let the victim exhale for 4 seconds. We do it like this, 1, 2, 1, 2, and give a respite of 4 seconds.
තප්පර දෙක කාලයක් තුල රෝගියා තුලට ඔක්සිජන් වාතය ලබා දෙන අතර තප්පර 4ක විරාමයක් ගන්නවා. 1 A B C 1 2 2 A B C. හදිසි ශ්වසන වාර දෙක දුන්නාට පස්සේ අපිට සිද්ධ වෙනවා.
After giving mouth-to-mouth resuscitation, we must check for signs of life. This can be checked by looking under the eyelids or the lips, if they are red or pale blue. We can also check for signs of life by touching the cheeks of the victim to see if they are warm or not. We can determine from there if there is blood circulation or not in the victim. If by any chance there is no blood circulation in the victim, steps must be taken to give the victim CPR. If there is blood circulation, there is no need to give CPR. We only have to administer mouth-to-mouth resuscitation. We will try to attempt at least 10 times of mouth-to-mouth resuscitation.
සංසන්න සිද්ධ වෙනවා නම් බාහිර පපුවෙන් ලබා දෙන්න අවශ්‍ය වෙන්නේ නැහැ. එතකොට අපිට සිද්ධ වෙන්නේ කෘතිම ශ්වසනය පමණයි ලබලා දෙන්න. එහෙමනම් අපි ආයෙ පාරක් කෘතිම ශ්වසන වාර 10ක් ලබලා දෙනවා.
How to administer CPR?
බාහිර පපුවින්නේ ලබා දෙන්න අපිට ඉස්සෙල්ලාම සිද්ධ වෙන මේ රෝගියාගේ හෘදයේ තියෙන ස්ථානය හොයාගන්න. මොකද අපි හෘදය තෙරපන්නේ. හොයාගන්න අපි මේ පපුවස්සි දිගේ
Before we give CPR, we must locate where the victim's heart is because we give direct pressure to the heart. We trace our finger down the chest like this to locate the heart. And then we do it like this near the main bone. And then the next finger like this. After locating the exact position of the heart, we take this position with our knees and feet parallel to the patient. And then we lock our hands like this and apply pressure. We do this 15 times until the patient is resuscitated.
රෝගියාට බාහිර පපුවින්නේ ලබලා දෙන්න. right. කියලා අපි 15 වතාවක් රෝගියාට බාහිර පපුවින්න වාර ලබලා දෙනවා.
Only trained individuals should administer CPR or mouth-to-mouth resuscitation.
Thanks for joining us on Mihi Madala. I hope you now have a better understanding of the dynamics of emergency situations, what first aid is, what is appropriate, and how it should be administered. Do join us again here on Mihi Madala, brought to you in collaboration with the National Science Foundation. Till then, take care of yourselves and stay safe.
Presented by the National Science Foundation of Sri Lanka.